Okay, let's go into HPA axis. This is something that is also very important. I wanted to talk a little bit more about HPA axis because this is something that is very often not talked about in patients in practices that are doing weight loss. So this is really important. So let's talk about the HPA axis. So as I mentioned, I did not major in art, so I always do the best that I can to make these drawings. But if something is not clear, please let me know. I apologize in advance for my handwriting. So let's take a look at this. Okay, so as we mentioned, every time we are stressed, I'm going to put stress over here. So every time we are stressed, we activate our HPA axis. And our HPA axis is really one of the most important systems that helps us regulate so many different processes in our body. And the better you understand the HPA axis, the better you understand patients that are struggling with weight gain. You also will understand patients that have hypertension, that have chronic inflammation. This is one of the most important systems in our body, or axes in our body. So every time we're stressed, our body is triggering the HPA axis, which is hypothalamus, pituitary, and adrenal. Now, that leads to the secretion of cortisol. So how would this system or this axis cause or contribute to weight gain? Let's take a look. So the first thing we're going to look at is the increase of gluconeogenesis that happens in the liver. So this is, let's say, our liver, and the gluconeogenesis is the process in which our liver elevates our glucose levels. So essentially, our liver breaks down our sugar reserves, our glucose reserves, and starts releasing larger amounts of glucose. That leads to increased secretion of insulin. Of course, our sensors in our body sense elevated levels of glucose, and we don't want elevated levels of glucose. That's not a healthy state to be in. So insulin is then secreted from the pancreas. Now, insulin is stimulating our cells to take in the glucose and to be stored as triglycerides, which essentially what it does is increase the fat tissue or adipose tissue in our body. Now, of course, we're not talking about mild secretion of cortisol. We're not talking about a little bit stress here and there. What we are talking about here is typically ongoing activation of the HPA axis. With some patients, that could be even a sort of abuse to this system, right? So overactivation of the system leads to chronically elevated cortisol levels. I'm actually brought a lab testing results from a patient that I'm going to show you exactly what that looks like. But cortisol is elevated. Now, typically, when we look at this system, our cortisol levels should be as following. Let's say this is 5 a.m., this is noon, and this is the evening. Typically, cortisol levels should be in a normal state. I'm going to put it in green, should be elevated and then slowly decline over time. Now, why would our body naturally do that? Because in the morning, our body needs glucose. Our brain, for example, cannot store glucose. And so it needs glucose for us to be aware, to be awake, to be mentally functioning, right? And so this is where its cortisol is at highest, and then you get higher secretion of glucose through this mechanism that we just talked about in the liver. But before you go to sleep here, you don't need elevated levels of cortisol. In fact, that's the opposite of what you want, because elevated level of cortisol are antagonistic to melatonin. So we don't want, here is where we want our glucose levels to be lower. However, the problem is, if your patient is chronically stressed, they struggle with anxiety, maybe even have dysregulation of this system, and by dysregulation, I mean every little stress, right? Every little stress now activates this system aggressively. And I'm going to show you a picture of what that looks like, again, from a lab. I searched and found a lab testing with results with one of the patients who actually shows that very clearly. But what happens is, if your patient have dysregulated stress response, they are going to experience either more anxiety or more stress, even with the smaller stressors that maybe you and I are not going to get too excited about. And this essentially would lead to overactivation of all this system and oversecretion of cortisol, which again leads to more sugar. So what you might see is this. You might see the levels here. You might also see the levels here, elevated in the evening where it shouldn't be elevated. Now, there's a reason why I'm showing you this graph. Typically, when would primary care practitioners measure levels of cortisol? Typically, it's going to be here in the blood test in the morning. Unfortunately, that doesn't give us the whole picture because cortisol levels fluctuate throughout the day. We have often tested 4 times a day before, as soon as they wake up, before lunch, in the evening, and then again when they go to sleep, before they go to sleep. And we've seen levels fluctuate throughout the day. So just measuring in the morning doesn't show us the whole picture because cortisol levels change. Kelly's saying Dodge test. Yes, Dodge test is one way to do it. If you're just measuring the cortisol level, and much more, I would say, probably not more efficient because it's the same, it measures the same thing, but it could save our patients money if we go with adrenal profile. So this test in particular is called adrenal profile, and you can find this. It's quite affordable. It's typically ranges between like $100, maybe $180 in some labs vendors, but this is more affordable. The way we do this is through a saliva test. So the patient just provides saliva into a little tube when they wake up, before lunch, in the evening before dinner, and then before they go to sleep. And that shows you the whole picture. So what if patient is having this type of presentation? They have lower cortisol levels in the morning, right? So you can see here, this is lower, but they have insulin resistance. So typically, if it's lower than normal, I wouldn't look at the cortisol on the HPA axis as responsible for the insulin resistance. What this is responsible for definitely is it could cause fatigue, can cause all sorts of symptoms, because remember, if you don't secrete enough cortisol in the morning, what will happen is you're going to feel tired. This is where a lot of our patients are looking for coffee. They're going for coffee, sugar, cookies, whatever it is that they can artificially from the exterior elevate their sugar levels, their glucose levels. But that, again, is just a very temporary situation. They might also be prone to anxiety. Cortisol is playing a role in modulating our immune system. And if we don't have enough cortisol, it can impact our brain function. This is what we refer to as sickness behavior. So it can contribute to anxiety. So what would I look at if there's insulin resistance? I would look at inflammation. I would look at environmental factors. I would look at nutritional deficiencies. There are several factors that we want to look at. Genova Diagnostics also offers this particular lab. Doctors Data also offers this particular lab. The major symptoms you're going to see is fatigue when the cortisol is lower, tendency to anxiety in some patients, especially female patients. I've noticed that happens more frequently because of the elevated interleukin-6, and also that's also associated with chronic inflammation, unfortunately. Okay, awesome. So let's go into another mechanism to understand why is this happening. So elevated glucose is just one issue that our patients with HPA axis could be dealing with. So the next one is cortisol. The next thing that elevated cortisol does is increase appetite. So every time your patients are stressed, and this is really a big part of the big contributors to emotional eating. So every time we have a lot of stress, we have secretion of cortisol. Remember, this is a part of our fight or flight response, right? So our body is feeling danger, and it's starting to store more calories. That could be one of the mechanisms that is causing that. But essentially what you'll see is elevated appetite. Now, that's not going to happen with every patient. Some patients might have decreased appetite, but essentially the hunger signaling is going to increase with some patients. And that typically leads to increase of cravings for carbs, combination of carbs, plus salty foods. Many patients might crave for energy dense foods. Now, this essentially leads to calorie intake that is much more significant than the patient should be eating. And then the next one is, of course, that I wanted to talk about. The next mechanism is the interference with our thyroid. So I mentioned that briefly, but I wanted to explain a little bit more. Every time you have secretion of cortisol, it reduces the peripheral conversion of T4 to T3, which essentially what that leads to is reduced levels of T3, which reduces the signals in our cells. So if this is our cells and this is the receptor, now we have less activation of our mitochondria. And that leads to reduce in our metabolic rate, essentially how many calories we burn, and with fat oxidation. So now you understand the three different pathways of how this system essentially works and what our patients might be struggling with. And as I mentioned, the most simple test to do is a saliva test 4 times a day, which is called adrenal profile. And these, by the way, can cause weight gain, central adiposity, and also slow down our metabolisms, as I mentioned.